On today's episode of A Nation Betrayed, we have Julie Threet and Ronald Owens. We are joined by these two California whistleblowers who refused to stay silent when silence became deadly. Today's episode is not speculation. It's testimony and it's truth. Julie's story is both personal and devastating. She's vaccine injured from the Moderna shot, and her mother was killed by the COVID injection. What began as trust in the public health system became a fight for survival, truth, and justice. Instead of retreating, Julie stepped forward into county chambers, city halls, and public records, demanding accountability for the injured and for the dead. Together, Julie and Ron have traveled thousands of miles across California, standing before city councils and board of supervisors, placing evidence on the record and confronting officials with what most refuse to acknowledge: real people, real harm, real families, and families that were destroyed. Ronald and Julie are not paid activists. They're not politicians. They are eyewitnesses to these crimes against humanity. This episode is about courage, consequence, and what happens when ordinary citizens decide that truth matters more than their own comfort. If you believe public comment still matters and advocacy still matters, and that voices can still pierce corruption, this conversation is one you need to hear. Thank you for joining us, Ron and Julie. Ron, I want to start with you and talk about what brought you into this fight, because you actually worked for the Department of Health, correct?
Yes.
So tell us your story and how you got involved.
Well, I should probably go back just a few years. I was working at the California Community College's Chancellor's office, and I saw this ad, two ads actually, one for the California Highway Patrol, Information Officer 2, and the other one was the California Department of Public Health. I applied for both. At that time, I was an Information Officer 1, so it was promotion. I wanted the CHP gig, but God had other plans for me. CHP, they hired internally. CDPH, they hired me, and I started there on March 2nd, 2009. So between 2009 and the time of COVID, I saw some things that just didn't seem right to me. And I just stayed in my lane because I was assigned non-vaccine topics. Although I did handle some vaccine-related press queries. I was what you call a public information officer, or PIO. And that is a person who's the liaison between program staff with the department they work for and the and the media. My job was to provide written responses to the media or prep subject matter experts to be interviewed by print journalists or TV reporters or broadcast journalists. So, long story short, I was working as a public information officer at the Office of Public Affairs, and I discovered something that Javier Becerra said on April 14th, 2022. He was the Department of Health and Human Services Secretary, and he was appearing on a White House virtual Convening on Equity Summit. And he's talking about the COVID-19 vaccines. And he said, quote, "We know these vaccines are killing people of color, Blacks, Latinos, indigenous people at about 2 times the rate of white Americans." Gail, Heidi, and quite naturally Julie, when I heard that comment, I was shocked. I couldn't believe what I heard. I played it back over and over and over again. And that's what he said. And he was talking within the context of COVID-19 vaccines. So 4 days later, on April 18th, 22, between April 14th and April 18th, I pulled together some information, wrote an email, and sent to my deputy director 4 days later. And I basically said, look, this is what Becerra said. And I need to state for the record that at that time, I did not find any data indicating that there was a disproportionate number of people of color, blacks, Latinos, and so forth that were dying from the COVID-19 vaccines. But the bottom line is, I found more than 26,000 people had died from the COVID-19 vaccine, according to the Vaccine Adverse Event Reporting System. I also discovered, and I shared with my management back then, that there were a lot of people that were sustaining vaccine allergic reactions, facial paralysis, miscarriages, heart attacks, inflammation, seizure strokes, and sudden deaths. And I advised my management to inform or apprise the directorate, the Health and Human Services Secretary, Dr. Mark Ghali, was that particular cabinet official at that time. And our office is always in contact with the governor's office. And I said, you need to inform the governor's office as well. Whether my management did that to this day, I do not know. But I did my due diligence. And when I sent that email back to my management on 11:58 a.m. that day, just about almost 3 hours later, 2:41 p.m. to be exact, I received a very, very dismissive, "Thanks for your email, Ron." That was it. My my boss seemed to be unalarmed that there were people that were being injured and dying from the COVID-19 vaccine. Quite naturally, emotionally, I was upset, angry, exasperated, all kind of feelings, and I was monitoring what was going on between April and October of that year. So I decided to revisit the issue. And on October 13th, 2022, I indicated that there's been an uptick of people that have been injured and died from the COVID-19 vaccine, from more than 26,000 in April to more than 31,000 in October. Well, I never got a response back from my deputy director, but my media team supervisor did respond back. And he said, look, your vaccine concerns are in conflict with the department's stance and research findings on vaccination. He invited me to, quote, learn about CDPH's official position regarding COVID-19 vaccines. He expressed concern that my personal research efforts may be a misuse of both state time and equipment. In other words, that was a threat.
Yeah.
So I was wondering if I should go ahead and file some sort of complaint with the Office of Civil Rights. I thought about it. I talked to family members about it. I prayed on it. I just felt led of the Lord, no, because I didn't want to come across like I'm this angry black man having a beef with the management. So I just felt led of the Lord to leave it alone. It's not about me. It's not about me, the messenger. And I felt like if I had have pursued that route, then it would have been construed that way. Well, long story short, much later in August of 2023, we had a virtual staff meeting just like we are now, the four of us talking. And in that staff meeting, there was a discussion about adverse events from the COVID-19 vaccine. And I felt like if I had remained muzzled, if I had to continue to muzzle myself because they were muzzling me, that would have been cowardly. So I mentioned to all the people on that call, several people on that call, about 12 of us, I think 12 or 14 of us. And I tried to convey the quote from Javier Becerra, what he said about these vaccines are killing people, et cetera, et cetera. I didn't do too well because I was angry, I was upset, I was depressed, all kind of feelings. My my boss told me to be quiet. In the black community, when you're trying to make your point, we call it talking smack. So I was just like talking while she was telling me to be quiet. I was trying to get the words out what Becerra said. And I remember saying that this is on the official White House YouTube channel. And when my boss, the deputy director, saw that I wasn't going to shut up, she directed the media team supervisor to shut down the call. And they shut down the call in mid sentence while I was talking. They wrote me up. I understand through the grapevine they wanted to dock my pay, but they couldn't do that from the get go because what we in state service call progressive discipline. I felt led of the Lord. It was time to retire. And basically, I immediately incurred a 55% pay cut, which is the difference between my salary and my pension. But I just could not sit there in good conscience, collect a check, and have this information not be shared with 40 million Californians. I retired, wrote a book, established a website, muzzletruth.com, and I spoke before small groups. Met Sue Frost in April of 2024. She was a supervisor in Sacramento County, and she was, I believe, the first on record sitting politicians to oppose the COVID-19 vaccines from the get go. Very courageous woman, very modest too, I might add, but very courageous. So I started going to Sacramento County Board of Supervisors. First time I appeared there was May 21st. And I shared this shocking information. Sacramento County is where I live. And they only gave you 2 minutes. So I went back 3, 4 other times. Each time I went back, I covered a different topic. And I began to formulate a document, a 5-page PDF that ended up to be 5 pages. And I thought I should inform my management. I already did so verbally, but in writing. After that, I'm thinking, you know what? I think I should inform the 57 other county board of supervisors. So I created 57 separate documents, went to all the county websites throughout the state of California. It took about a whole week last month of July in 2024. Worked on that, sent 57 separate emails. Then after that, I'm thinking, you know what, Lord? I felt led of the Lord. It's time for me to go and inform in person. So that's how this all came to pass. And so I was riding on my Tandem Spider motorcycle from county to county. And the reason why I need to state that I am going and have gone to counties is because the California Department of Public Health has a relationship with the Board of Supervisors. The Board of Supervisors in California are like the local legislative local government. The Board of Supervisors are elected by the citizens of their county, and the CDPH has a relationship with the county health officer or with the county public information officer. So even though I retired on January 30, excuse me, on December 31st, 2023, my oath as a public information officer or state service did not expire when I retired. So I'm still performing my role as a public information officer. So along my track from county to county, I met Julie Threet on October 8th, 2024, when I spoke before Butte County Board of Supervisors. So that's where I met Julie Threet along my travels. And so since then, she and I have partnered. I think she's gone to 33 counties and I've gone to 51. So that's the answer to your question.
Thank you for that introduction. And I mean, we appreciate all the work that you do. Julie, let's go to you. And I want them to hear about how you entered into this battle. And because yours is a very personal story, and you have, you both have skin in the game, and you very directly with your mother and yourself. Go ahead and explain to people.
Yeah, it's crazy. Well, yeah, I'm here in Chico in Butte County, Northern California, and I moved here in 2014. I had come out of retirement. Well, I decided to leave Silicon Valley where I worked for 25 years, raised a family, and I was exhausted. I was tired of all of that. And I'd been an HR VP for many years, and my husband died suddenly. And now this was 2011 when he died. But I decided in 2014 I needed to get out of Silicon Valley. So I up and moved, and I came up here to Chico. My brother lived here. So I found a house and moved me and my two dogs up in 2014. And I didn't need to work for pay. I was very fortunate that way, but I needed to do something because I was a widow and I needed to get out of the house. Otherwise, I'd be sitting in my house doing nothing. So I just started going around this community in Chico, and I started going to city council meetings, started going to school board meetings because, again, I don't have kids here, but I pay property taxes here and they spend that money at the school district. So, and then joined the Elks Lodge, started the American Revolution, just joining all these organizations, right? Getting to know the community, newcomers. And that's when I started to become more active in the community. We had a lot of problems in 2015 with needles. Oh yeah, I've been fighting needles ever since I got here in 2015. These were syringes that were handed out by the Harm Reduction Coalition people, the socialists that want to keep drug dealers healthy by clean needles. So they were doing it at the park by my house, and these needles weren't being returned. You're supposed to give them 20 needles and get 20 needles back that are dirty. No, it didn't work that way. So all these dirty needles were ending up in our parks and in our creeks and all of this sort of stuff. So we started as a community really kind of beating on the city council. You need to do something about this, and the county and Oroville, wherever we could go. So, that's when I became really introduced to how do you go before your elected officials in an effective way. And you've got to learn the process for that particular body of officials. What they did at the school board here in Chico, very different than Chico City Council, very different than Butte County, different process to get a public comment on the record, this, that, and the other. But you got to start. And then as you practice more, you get to not only know the clerks and the process, you get more comfortable stepping up to the podium and approaching a mic, knowing there's a lot of eyeballs on you. But so that's kind of, where I started with this whole process with the syringes. And luckily we got them stopped. We literally got a ban on syringe exchange programs here in Butte County because of my efforts. Partially. So 2015, that whole period of time, we had a campfire, right? Blew through Paradise right across the ridge. I had to evacuate. I had this big old fire, and I did a lot of work with the fire recovery. And I started working at Enloe Medical Center. So I decided healthcare was going to be a new new job for me. And so I started working at Enloe Medical Center. They had a big army of volunteers, about 300, and we did whatever they required so that the doctors could doctor, the nurses could nurse, and we would fill in the gaps. And I found my place as a patient ambassador at the trauma unit at Enloe. So every Thursday I had a place to be. Get up, go over to the hospital and sit with trauma patients, sit with their families, do whatever the nurses or the doctors needed. I loved it. You got a badge, you got a uniform, the whole thing, you got training. And then that expanded to the gift shop. I loved retail. So I was a natural at working at this gift shop. I loved that. That was another day of the week. And then they wanted me to join their board of directors. Boom. I love that. That's my calling down at Silicon Valley. I was on a lot of board of directors. So I went, okay, let me join the board of directors. So I was in charge of special events and other things. So this hospital pretty soon became my life. A lot of my friends, family. I started taking college courses at Butte Community College, medical terminology, medical billing. I thought, okay, maybe medical administration is a new calling for me. So that was all happening, and COVID hits. Okay, the whole, wow, our world is upside down. Enloe's, we got overflow supposedly and all this stuff and going on. And it was just a crazy time, 2020. And I have at this point, my mom, who was 80 at the time in Silicon Valley. She was this healthy woman, walked every day, lived a healthy life. But, oh God, we've got this crazy virus. What the heck? Okay, Mom, what are you going to do? And my daughter as a medical assistant at Sutter Health in Alameda County. So she's actually working, 6 days a week, really long hours, no PPE. All her friends are at the beach because they're not essential. So 2020 was a pressure cooker, right, for all of us. And at the end of 2020, here comes the vaccines. Okay, so they roll into Enloe through the Butte County Public Health Department to be delivered into Butte County. So yeah, there I am. And I raised my hand. Yes, I will take one of these shots, two of these shots, and I want to go work at these clinics. I want to get us back to, I lead with my heart. I want to get us back. I want to get us out of this. I bought the whole thing. So January 2021, took my first shot of Moderna, got a big old knot in my arm, but okay. Second shot in February. And I'm at these clinics, and literally, you guys, I love this job. I mean, there it is. It's at the warehouse out at the fairgrounds, Silver Dollar Fairgrounds here in Chico. And we set it up to really make as good of an experience for the people coming through. And so, every day for 6 hours, or the shifts that I worked, I would go in and I would, I'm non-medical, so I can't push a syringe, but I would pass out the syringes. I would make the syringe kits. I would fill the needles in the draw room. I would, get the patients through the lines. Yeah, that was the draw room right there. And you can see on the wall there, those are the instructions on keeping these things frozen and what do you do when you open them for certain periods of time. It was fascinating. There's the refrigerator, so I was absorbed in this whole thing. It's just fascinating. So 6 months out at those clinics at the fairgrounds. At the meantime, I'm getting brain fog. And I'm like, with this brain fog, what is going on? It's out of body. I go and get a CAT scan, and I've got microangiopathy. Something has hit my, part of my brain. And I'm like, okay. And I'm looking at this neurologist going, well, what do I do with that? And he's like, well, you're just lucky if you don't have a stroke. We got to watch it, make sure it doesn't grow into a tumor, and there's nothing you can do. And that was March of 2021. I went, okay, I don't worry about things I can't control. So I just went on my way. I didn't even think about the vaccine at that point. In the meantime, again, this January through June 2021 was so just bizarre, because not only am I injured, but not knowing I'm injured, I'm working at these clinics and I'm seeing injuries. I'm hearing about injuries. These young nurses that I worked with, Butte Community College nursing students, they're talking menstrual disruptions, all the, menstrual disruptions, no period, too many periods, late periods. And I'm like, what is going on? And I asked Dr. Miller at lunch one day. He's our county health officer. I said, what is going on? I'm hearing these poor young nurses. Oh, it's nothing. I go, are you sure? I mean, I'm also hearing the women that are coming for their second shots talking about this. Are you sure? I have a daughter. I would like her to have children. So I need, straight answers. Julie, go back to work. Okay, fine. I watched the Chico State track athlete. I tell this story all the time. Kid wants to run track. They bring in this Chico State track team. Kid sits in the chair, shot in his arm. He's on the floor with a seizure. I'm like, what is going on? Why is there a kid on the floor with a seizure? Why are we not having ambulances roll up? This whole thing. So I know God put me there for a reason. I was strong enough to handle it. I was absorbing it all at this time, not knowing what was going on, but okay, I'm trusting people. I'm trusting my public health department. I'm trusting Enloe Medical Center. Every chain of command up to the CEO is telling me safe and effective. So what you're looking at there on the screen, so that's what we call the whiteboard. And that whiteboard was how we tracked what was going on that particular shift for that particular day. So you can see the lot number. It's a Moderna 038B21A. You can see that we got to make sure the syringe is right, because the Moderna had more lipid nanoparticles, so it was a bigger draw than the Pfizer, which was the 0.3. We have syringes for normal people, and we have the longer syringes for what we call the fat people, because it's got to get to the muscle. So I had to make sure that if I saw a person coming up that was heavier, I'd have to make sure that syringe getting to the nurse was the longer needle. And then they'd keep track of all the doses that were being administered. And then you can see on the right side the tick by day. So I thought this was just fascinating. They really wanted to make sure that the process was followed. And once that 038B21A, once all of those doses were delivered, there was 10 to a vial, but they'd come out of the draw room. Once all of that was exhausted and every syringe was accounted for, we'd start with a new batch. So I was logging. This batch stuff is very important. It's not like every syringe was a different batch. It wasn't like every vial was a different batch. We were literally doing one batch at a time, and we were doing Moderna one day and then the next day Pfizer kind of thing. So I was absorbing all this information. But yeah, so June 2021, we kind of stop with these mass vaccination clinics, right? We kind of just go back to normal clinic process. You go to the hospital or whatever it is. And I'm back at the hospital just doing my normal shifts, but I'm also watching the news, because Joe Biden's on the news screaming at us about the pandemic of the unvaccinated. And I found that extremely, that was just, I wrote down, you guys, every single word he said to us in my handwriting in a book for my great-grandchildren. It's in my will documents. I'm like, look at what your president said to us that day. It was horrifying. And I'm watching alternative media because we're getting Fred propaganda, and I see Naomi Wolf on with Steve Bannon talking about menstrual disruptions. Wow. You mean the menstrual disruptions I was raising with my local county that they were hiding? That's a thing. And that was my first, like, oh my gosh, let me start researching. Again, this is like September 2021. I've now got tinnitus ringing in my ear 365. Oh, there's a Pfizer paper on that I find. Okay, that's a thing. Christmas 2021, I just was researching everything during that break. And I found a Swiss Policy Research article. Woman got her COVID vaccine, 26 years old. She's got MS, and there's her brain scan, looked just like mine. I went to my dog. I was screaming at my dogs, where's my brain scan? I went and found it, matched them up. They looked identical. I went, I'm vaccine injured. I looked at I'm like, my God, I'm vaccine injured. This is insane. I'm injured by this vaccine. And the final kind of piece of information I had was Dr. Robert Malone with his Substack about his injury. And somebody in there said, look up how bad is my batch.com. And I went right to, where's my vaccine card? And I went and found it and I plugged it in, and there's, wow, top of the list. There's my 04202. That's a top of the list of bad batches. Oh my gosh, this is outrageous. So now what do? I love this job. I love what I do for a living. I love supporting people, but I'm processing this. And I go back January 2022 for my first shift at the gift shop. And in walks my boss going, Julie, if you want to keep doing this job here, again, for no pay, but okay, you need a booster. I went, you want me to get a booster? Whoa, wait a minute. And as I'm like going, this is, and my, again, my mom always taught me, don't get angry and mad in that moment. Take a deep breath, go take a walk, figure something else out. And I said, okay, can I have a meeting with you on Friday? I'm not going to scream and yell here in the middle of this gift shop, but okay. So I bring them this whole folder thinking they're going to go, oh yeah, we'll give you an exemption. Oh my God. Or they're going to go, oh my God, we better go, notify the CEO or whatever. They went, okay, I understand. I believe you. They're like, I believe you, but you need a booster. I went, okay, no, I don't need a booster. Thank you. I just gave at the company store. And, but I didn't have to, I had to go home and think about it, you guys, because it was mental health versus physical health. Because if I don't take this booster, I have no job. I have no purpose in life. I have no career. What am I going to do? I have nothing to do. What am I going to do now? So I had to come home and think about it and do the whole pros and cons, because I know my mom's going to be devastated if I just walk away from this whole career that I'm telling her is this wonderful place. She's going to be like, are you insane? And then, but I'm like, oh no, what am I thinking? I'm going to die. I can't leave my dogs alone. So I told them I can't do this and walked away. So after a whole night of crying, I think I woke up February 1st, pissed off, mad. I'm angry now. Somebody's going to pay. Somebody's going to be held accountable for all of this. You don't poison me and then just get to just say, go on with your life. No, not happening. So I immediately start thinking, okay, who's responsible? Butte County Public Health. I know who they were at those clinics. I know Dr. Miller. I worked for him. I know these people that were there, and I know they work for the county. And I know the county then is going to be the ones that received all the vaccines, got all the vaccines, and then distributed them, whether it was to Enloe or Orville Hospital or, anywhere in between, the school, whatever. So I immediately start going to those board of supervisors, again, thinking, of course, I'm going to walk in with all of this information, research, and they're going to go, oh, Julie, my God, let's go stop this now. And oh, these men were looking at me, and these were conservative GOP. I helped elect them, public officials. And I'm like, they're looking at me like, okay, thank you for your comment. I'm like, thank you for my comment. I'm standing here, and so that was, March of 2022. And I really started then, again, just gathering more information, doing FOIA requests, going to school board meetings too, going to city council, telling them you're allowing these little vaccine bans to roll around Chico. Aren't you mad about this? And it was April of 2022 when, it was March actually, 2022, when Javier Becerra came in. This is how Ron and I met, through Javier Becerra. He, HHS secretary, comes into Chico on that Monday, March the 14th, 2022. People are calling me, Becerra's in town, Becerra's. Oh, I don't know. What the hell do you want me to do about it? He has a private meeting at Enloe with the public health department with, no information. Nobody had told us about this the week prior at the supervisor meeting. When we got a COVID report, nobody said, hey, guess what? Becerra's coming on Monday. Not a word. So I knew there was already something fishy going on. And that night, All of a sudden we see the news articles. Javier Becerra's in Chico to urge vaccinations of the children. Parents are vaccine hesitant. And so that next morning, I then get an email. Me and Diana Dries got an email. We're like the most active ones there at Butte County, saying, we've made some changes at the county, so we're no longer going to have a COVID report, which was required by law. When you have an emergency order in place, you have to have one once a month. So they already started to violate that order, but they didn't want us talking twice during a meeting. So they wanted to cut one of those off. They had strategized this all on that Monday, because all of a sudden Tuesday we're getting this email. And then they go, oh, and by the way, the public comment, which had been at 1:00, perfectly. I can go down to Orville, get there and leave. Oh, we're going to do it at the beginning of the meeting whenever we decide that to be. So now we have to go down there at 9 a.m. and wait for them to decide to have public comment. So they were making it extremely difficult. And I knew, again, wow, you guys all just concocted this in that meeting. And so I did a FOIA request, got all the emails, all the information about that private meeting. And it was Becerra who paid Butte County $225,000 to go hunt little kids in Chico. Not Orville, not Gridley, not Paradise, in Chico, 5 to 11-year-olds, 4 months. And they sent pop-up little vans around Chico. And me and Diana went to all of them and recorded all of them. The first one at the library on a Monday with parents, moms bringing in their kids. The second one was at the Chico Mall, which you showed a picture of that. Balloons, candy, kids walking up. Me and Diana were like losing our brains. And I'm like, I injured. And we went and bought the RFK Jr. book and took, and I know these people, right? I'm like, Wes, what are you doing? And, you need to read this. What are you doing? Are you giving informed consent? Show me the vial. I bet you that's not Pfizer's Comirnaty that's all, licensed. He's like, well, sure it is. I go get me the vial. He brings out the vial. I go, no, that's the BioNTech. Sorry, that one's emergency use. You're lying. And so I just tracked that all the way through till the last one they had here in Chico at Sierra Nevada Brewery, June of 2022. Inside the brewery, on mahogany tables, they were vaccinating people. And it's just so dystopian. Really, like, why? What's wrong with you, Sierra Nevada Brewery? So anyway, so that 2022, I'm still fighting. I'm like, this is crazy. We're gathering information, and I start researching these batch numbers, and I hook up with Albert Benavides. Welcome the Eagle. He is from Silicon Valley, went to Chico State. So we were like, wow, this is crazy. He helped me file my VAERS report online. We did it online. And I'm researching these batch numbers. And I literally now get certified with MedAlerts, National Vaccine Information Center. Again, I plug in my 042020A, and up pops the actual reports. And there's 47 dead people. And I went, whoa. And I'm reading the death reports, like 56-year-old gets the shot and that night is dead. I'm like, oh my God, she was my age getting the shot the same day I did. This is a crime. This is a crime. Oh my God. So I'm, processing that. I asked my family for their vaccine cards. Give me your vaccine cards. I'm going to research these batch numbers. My kids are like, stop it, Mom. Stop with the, sending me the information. I don't want to know. My mom goes, sure, honey, here's my vaccine card. Boom. I get it on my text. You guys, I hit the floor crying. 4 shots. I went, my God, Mom, why'd you take 4? I knew you took the booster, but why'd you take that 4 shot in April? Well, she took those 2 boosters because my, sister-in-law, her daughter-in-law lost a kidney to Pfizer. So she was getting the boosters to come up so she could be around Lisa and not, immunocompromised. I'm like, oh my God, Mom, but how is it that you don't have myocarditis? You don't have any problems at all. Well, she lived a very clean life. She had no EMF in her house. Everything was, hardwired, and she would shut off the front TV, shut off her cell phone, and she'd go back into bed and read. And then up in the morning, she'd go walking. She'd tend to her garden, touch all the grass, touch all the plants, get the sunshine. So she was living this healthy life. And I'm like, man, you are the way forward. Let's use you as the model of how, you cannot be injured. August 15th, 2022, that all came to a screeching halt when I got the call that she had died. Died suddenly, on vacation in Wyoming, healthy woman. And I get the call in the morning. I go, what do you mean she's gone? I just talked to her. I knew it was the vaccine immediately, and I had her vaccine card. So I start screaming and yelling for the coroner and the sheriff. I want you to investigate this like it's a murder. This woman's been murdered. Here's her 4 shots. They're like, and I'm trying to process all this. Well, having to tell my kids, this is my son's best friend on the planet, his grandmother. Talk to her every day. And I'm like, I've got to tell them. But I need to tell this sheriff. I need to inform him why this is a murder. My brother, in the meantime, is like, oh, I'm flying out there tomorrow. I go, Joe, what's the rush? She's at peace. Thank God she died suddenly. She died in Wyoming where she was born. She died at my aunt's house in this beautiful ranch house on top of the Bighorn Mountains where she wanted to die. I mean, literally. So she made that happen. So her body's at peace. We don't need to rush. They need to figure this out. She's, what killed her? And the sheriff's calling me like, do you have her doctors? She doesn't have a doctor. She's never been sick. She's never been hospitalized except for to get her arm worked on. So you've got her suitcase. He's like, yeah, there's no drugs in there. I know, she's healthy. It's the vaccine. So they had to call in because nobody just dies at home without having an investigation. And so Tom Bennett, the pathologist, has to be called. So that Tuesday night, in the meantime, my brother's flying out there. And I'm like, no, I'm not going. I'm laser focused on getting information. I'm pulling all of this information, Jessica Rose and Mike Adams and Dr. Malone, and I'm flooding all of my family and and the sheriff and the funeral home and now the state pathologist with all this, and they're getting overwhelmed. They don't understand. They have no clue. Wyoming didn't really vaccinate that much. They weren't obsessed by it. So the state pathologist is like, Julie, I have no clue what you're talking about. There's no test for this. So, all I can tell you is sudden cardiac event, SADS. He told me SADS, sudden adult death syndrome. I go, and that's when I went, like, I'm yelling, you're like, SIDS? Like, now I know SIDS is a vaccine death. You're calling it SADS, the sudden adult death syndrome? Oh my, it's the vaccine. Hello. And so they got her tissues and, and I'm like, and then I'm trying to figure out I know it's the clots. It's those fibrous clots. She didn't have myocarditis. She was 120 pounds. She had no reason to have a heart issue. So I'm like, it's those clots. They clogged it. They clogged her arteries. It stopped her heart because she woke up at 6 a.m. to go to the bathroom. And by 8 a.m., her phone was ringing and she didn't answer it. My aunt walks in there. She's dead that fast. It wasn't a heart attack. She wasn't like that. It was literally like those things clogged it and just stopped the blood flow. So I'm like, so Mike Adams, the health ranger, Diana Dreiss gets to him and he goes, do an ultrasound. I'm like, that's perfect. Cause she does want to be cremated. Okay. And I'm going to honor her wishes that way, but we don't have to rush. Can we have an ultrasound done over her body to get things done? And of course, my brother ordered the cremation. Only one child needed to approve it. So she goes and I don't get my ultrasound, but I do have her tissues in her lab stored. So and I know there's some testing that's now available. So I'm going to be able to get the test to prove that the spike protein, whatever, killed her. But so that was 2022. And here I am. 2023, I start fighting at the Board of Pharmacy. I start going to Sacramento Board of Pharmacy. You guys are poisoning people at my pharmacies. I don't like that. So I start doing public comment. I've done 13 there. And then here comes Ronald Owens Jr. in 2024. In the meantime, I've had both retinas detach. I've had 5 emergency eye surgeries. I've had anemia so bad that I was hospitalized. I've now been spiked by blood transfusions. So I'm covering all the bases. You tell me what you want to cover and I'll cover it. But Ronald Owens Jr. comes into Butte County. And now I've been to Butte County for their public comment probably 35 times. And I'm like exhausted by them, but whatever. And all of them are on my Rumble channel. But here comes Ron. I'm like, who is this black guy standing up there telling my board of supervisors, I just wrote you people in July. And I'm like, what? You're getting information from a whistleblower from and you're doing nothing with that. So I said, Ron, where's your next county? I'm going with you. I'm done with Butte County. Let me get on the road. Let me get out of this house. Let me get a new purpose. And now it's fighting medical freedom. So here we are. Yeah. A lot.
Yeah. So before we go into how the strategy you have and how you work together, I want to play just one episode of where you're talking to the San Francisco County Board and you tag team. Like it's a beautiful tag team. You speak first, and this is the art of what I say, turning 3 minutes into 6 minutes, 5 minutes into 10 minutes, really expanding on each other. So you guys do this beautifully, and I'm going to play it here. Hopefully you will be able to hear it, and me go.
San Francisco County Board of Supervisors. My name is Julie Threet. I'm appearing before you today to appeal to your sense of duty to protect the members of your community from the COVID-19 vaccine and support any victims injured, me, myself, and I being one of them. After my 2 shots of Moderna, I suffered microangiopathy, 2 detached retinas, and I'm suffering from a heart condition. I'm from Butte County, and I traveled down here today with another whistleblower, Ronald F. Owens Jr., to alert as many counties as possible. I've spent the past 3 years since being forced to resign my healthcare job rather than take the deadly booster to speak out and warn people. My request is for you to have an official agenda item or a hearing set as soon as possible to hear directly from medical freedom doctors and researchers who will describe how this vaccine is harmful to every human being and should never be injected into pregnant women or healthy children. Take down all references to this product being safe and effective from your website. I'm a former healthcare worker, as I said, in Chico. I'm also a retired HR executive of 25 years in Silicon Valley, and now I'm lead investigator for VersAware.com, an organization that helps victims file their vaccine adverse event reports, and I produce data for the public. I will work with your health commission to train them on how to access reported VAERS data. As of the end of February, there were 96,682 injured people from the COVID shot in California alone. 7,009 are children. 721 are deaths, my mother being one of them, a 79-year resident of Sunnyvale, California. 5 are dead children. Please, I'm begging you to take this seriously. I'm going to hand you some information here. I've got 13 doctors listed at the end of my credentials that will come and again speak to your health commissioners. I know that you're dedicated to public health, but there's got to be some, you've got to be taking this seriously. Thank you so much.
Thank you for your comments.
Take this.
Someone will come up
Thank you.
to pick up those papers. Next speaker, please.
On April 14th, 2022, Department of Health and Human Services Secretary Javier Becerra said this regarding the COVID-19 vaccines, quote, "We know these vaccines are killing people of color, Black, Latino, Indigenous people at about 2 times the rate of white Americans. My name is Ronald F. Owens Jr. I was a public information officer at the California Department of Public Health for more than 14 years. I brought this information to my management on multiple occasions, but unfortunately, they made it about me, not about you, not about the 40 million other Californians. They muzzled me, but I would not and did not muzzle myself. So on December 31st, I retired prematurely. I immediately incurred a 55% pay cut. The difference between my salary and my pension is not about money. It's about doing the right thing. Last July, I sent this board and 57 other county boards of supervisors all this information. I followed up in December. I sent this board and the 57 other boards of supervisors that between August last year and December, more than 400 people filed entries in the vaccine adverse event reporting system. 2 people died. You have a duty to stop promoting, stop administering, and stop distributing the COVID-19 vaccines because they are killing people.
So I really like how you both, it's like perfect execution in the way that you get the powerful information in 3 minutes. That's very hard to do. And you piggyback off of each other. And I've seen times when Ronald speaks first and then you go and you speak first and Ronald goes. There's like a gazillion, if people should go out and follow you on X because all of those examples are out there and they could literally teach themselves to do this just by watching the way that the buddy system, right? Like, I mean, you guys do it really, really well. And I liked Ronald, I liked your delivery there where you hit him with some hard facts, then you introduce yourself and your credentials, and then you remind them that you sent them information, that they have information, and that you sent them a follow up. And now here you are again. And so the public now knows, wow, he sent them information. He sent them a follow up to their information. And now he's here again. Why didn't they do something? Right? Like, that's what, when I saw that, that's what I was thinking about. Wow, he sent them information, followed up. Now he's there. And Julie, when you were talking about, you made it personal. Hey, this is personal. I'm not just talking about numbers. My mother died and I am injured. I am one of the injured. And then you tell them where they can get more information. Bears aware. I like how you slipped that in there. And that was very good. And so I don't know who wants to go first, but maybe talk a little bit about how you came up with this strategy, because you both were doing your thing. Like, you both were doing this, and then God teamed you up and made it like a dynamic duo in how you handle this. And I also want to know if there's any others that kind of you can get to join in different areas. Go ahead.
Well, I mean, yeah, it's, it's funny. It's just God. I mean, God brought us together, and we do, a lot of homework in advance of the meeting. So we, the one thing you want to do is you want to know your audience. So we'll, if we decide we're going to go to San Francisco or Marin or wherever it is, we immediately start to research, and we look, who's the sheriff, who's the DA. Can we find any videos about the county? What can, what was their stance on the COVID vaccine? What were they doing? And, how much time do you get? And do you put in a card, this, that, and the other? And then, we just do our best. And so most of the time, Ron goes, you go first. I go, and then sometimes, they'll call him first. It just kind of depends. Sometimes they're on the phone, sometimes they're in person. So it's just, you just kind of go with the flow and decide who's your audience. I tell you that the lady that spoke after Ron, Elaine Zhao, I think is her name. She went up there and she went, yeah, these vaccines are killing people. I've been telling you guys this for 3 years. It was kind of fascinating, but yeah, it's homework. And then you show up and then you pivot, because sometimes things don't go your way. You can see there, I mean, now we've gotten to the point where Ron videotapes, because there's times when we go in there and then they're like, oh, the video failed. Sorry, we have no, oh, okay, well, we got to back up. Or they're too small of a county, like Colusa County is too small. They can't do video. So they do audio recording. So we've gone in to get the audio disc, but we're like, no, we need to have visual. So he'll start to record. We just, we don't like to maybe sit together in the chambers. We kind of spread out so they kind of don't see us coming, kind of thing. But yeah, we tag team. So it's a strategy. And we've kind of worked on it. So yeah, what do you think, Ron? What do you add to this?
You got to unmute yourself, Ron.
Yeah, like Julie said, it is God. God led me to do what I'm doing, and I'm just going alone. But God said, "No, I want you to go with somebody else." So that's how we teamed up. I gotta share something comical that happened. There's that photograph right there. Okay, so I didn't know that Julie was going to be there that day. I basically just rode my Can-Am Spyder to San Francisco all by myself, and I parked on the garage there. And I sat down and I basically let people know where I'm at. And Julie's on that thread, that group chat. And I said, well, I'm in San Francisco at San Francisco Board of Supervisors, City Hall, San Francisco. And so Julie texts and says, well, I'm there too. I didn't know she's going to be there. She didn't tell me. She probably didn't even know until she decided to go. So basically, she texted and said, I'm there. And I said, where are you sitting at? She says, I'm sitting in the chambers. I says, where? I look around. I don't see her. She doesn't see me. And then we both discovered that I was sitting in front of her. She didn't know that I was sitting in front of her. I didn't know that
I got there late because, Yeah, coming from Chico, it's a long ride. So I didn't really know. This was an afternoon meeting. So I got up in the morning. I thought, okay, getting from Chico to San Francisco is not an easy ride. You got to go across bridges and all this. I thought, no, I'm going. Let me go. And so it's kind of a last minute thing. So I didn't want to tell him I was going. And then I'm like, when I got in there, it was packed. And I'm like, you just look for a seat, And I'm like, I'm sitting down. And all of a sudden he's like, where are you? I'm like, where are you? I'm like, wait a minute. I see your head.
So that picture right there was taken, that selfie, moments after we both discovered that we were sitting right near each other. That was one of those organic pictures. So basically, I'm back to your question, Gail. Yeah, I come very credible. And I was very forceful that day because I'm in liberal San Francisco. They believe in diversity, equity, inclusion. Yeah. So basically, I played that race card.
Yeah.
I played that race card by appearing up in person, by telling what Sarah said. And we did have to do it within a confined period of time. Some counties like Santa Clara, like San Mateo, they only give you 1 minute.
Wow. You can't. Yeah.
And this county was what, 2 minutes or was it 3 minutes?
I can't remember.
Yeah, I can't remember.
Most are 3.
The average is 2 minutes. In Stanislaus, in Colusa, was it Calaveras? They gave
was 5.
5 minutes. That was like, wow, that was great. But on average, it's between 2 and 3 minutes. So yeah, basically we're very credible. I mean, Julie has her whistleblower story. She's injured. Her mom died from the vaccine. Here, I worked at California Department of Public Health for almost 15 years. So this is God. This is truly, we did not plan this. We do our research beforehand. What are the local issues? What do the chambers look like?
Yeah.
Where will we be standing? Where is the dais? Where is the rostrum? Sometimes there's 2 rostrums, one on both sides. Sometimes there's one in the center. Sometimes the rostrum's on the right side or the left side. Sometimes it's held at a library, like, for example, I forgot what county, Trinity, I think. So, yeah, we do our homework and how much time we have, where we would be sitting. Sometimes we like to sit on camera. Sometimes we like to sit off camera. And so we do a lot of research, but a lot of the coordination is we're just going with the flow, Julie mentioned a week or 2 ago, and I like this. She said that we are God's independent contractors. We're not part of an organization. We're not calling any meetings. We don't set an agenda. This is where we're going to planning to go. We're just going with the flow. And I understand that another group of people, spearheaded by Laura Desmarais in Idaho, they're starting to go from county to county as well. So that's encouraging to know that other people in one state, and hopefully there will be other states that will pick up what Julie and I are doing here in California and what they're doing in Idaho. I need to share one quick thing. If people go to muzzletruth.com, there's a COVID-19 shot warning template. You click on that red, click to view, and there is a 5-page PDF that anybody, anywhere around the United States, probably around the world, can send on my behalf. The to is left blank. The from is sent on behalf of Ronald F. Owens Jr., retired information officer 2, California Department of Public Health, has my email address. The subject is COVID-19 vaccines are killing people. Federal health chief said, and the date is left blank. And people can either print that, fill in that, send it to their local county commissioner, city council member, board of supervisor, or whoever, or they can forward it to them. And if they're really sophisticated, they can write the names electronically and send it that way. So that's my way of equipping people to amplify Julie and my message here in California.
Okay, we'll get that up on our resources on betrayalprojectusa.org as well. We have your book under recommendations, but we'll get that website up too. We also have Bears Awares up there already. Mm-hmm. But so let me let me pivot just a little bit. I want to ask you, so what we hear a lot, people are so focused on the federal, right? They're like, they want to battle right away to the federal, and they really don't always understand that all politics is local, right? The
Mhm.
local, your local, the closer it is to home, the more it affects you personally.
Exactly. Yeah.
So, so what kind of talk a little bit about how you, I don't want to say target certain boards, but how you decide where you're going to speak, what their responsibilities are, the different boards, and then also this is just if you can remember it, some lessons that you've learned when you first started doing it that you've incorporated into how you guys are now.
Well, the lesson that I have learned is quite naturally, I wanted to influence the Board of Supervisor members, all 290 some on, 298, I believe, to do the right thing. They're not doing the right thing. Vast majority are just sitting on their hands. But the lesson I've learned that there are people who are listening in the chambers.
Mm.
County employees are watching the proceedings from their desktop computers. We don't know who's going to be watching in the replay remotely. In one case, for example, I had a woman who saw my appearance before Fresno County Board of Supervisors on Facebook. Someone was there, recorded me, and put it on Facebook, and she said, "quote Ron, I tracked you down." So we don't know how many people are listening to us because our state, our federal officials, state Department of Public Health, Butte County, other 57 other county health folks, mainstream media, they're complicit. They get
Yeah.
ad revenue from big pharma, social media. They've been censoring everybody. So we're taking the message directly, locally, county by county to the people. It's
And
laborious, it's time consuming, it's expensive, but that's what we're doing.
Yeah.
thank you. And tell me something. The Board of Supervisors, tell me in their capacity what their duties are. What can they do to end the carnage that has been unleashed on California?
Well, I've quoted them particularly in California, Health and Safety Code 101025. They have a statutory responsibility to preserve and protect the public health at minimum. And I've told several, and I followed up, by the way, every time I make a appearance, I follow up in writing. At minimum, they need to at least tell their residents that these COVID-19 vaccines are not safe and effective for everybody. That's at minimum.
Yes.
What they should be doing is having their county health officer, like Shasta County did, where they basically he presented what the vaccine is, the pros and the cons, and they had a public comment. Some people thought the vaccine was the best thing since sliced bread, and those of us who know better, they opine on that end of the argument. That's what they did in Shasta County. We appreciate what they've done in Shasta County. Julie and I were involved with developing that. Unfortunately, we weren't there when their hearing happened last May, but at least they did that. But the bad news is that Shasta County is still promoting the COVID-19 vaccine, even after all that.
Yeah. So,
That's-
and again, the thing that you have to know is your county gets money from the state, from the California Department of Public Health. So go do a FOIA request from your county. Say, I want to get all the documents on immunization assistance plan. That's what I did. We got for COVID vaccines, and actually all the vaccines they administer through the public health department, $3.14 million in one tranche. And then they got another $2 million. So they're getting the money into the county. So the county supervisors have oversight over that money and over what their public health department is doing. So I target the CAO and I target the supervisors. You have oversight. I expect you to react accordingly in term, whatever it is, right? I mean, roads, bridges, or public health. Their public health department works for them, works for the CAO. So you need to go, not just believe everything they say, but go ask questions. And then, how's the money being spent? And then it's, how are you advertising for it? Just get rid of the advertisement. Okay, how about that? We'll just start with something simple. How about you show where you're telling people about VAERS? Because at the clinics in California, they didn't talk about VAERS. They gave VSafe information on a little card. So it's not even on the website. So I'm like, how about you just start with, don't promote it. Don't, and then put, what if you're injured? Where do you go? Put the VAERS, put the information for how to file a VAERS report. Put other strategies. You can use ivermectin. You can use, whatever. Put other strategies other than just the vaccine. So that's to me, they manage the public health department in the county, so they need to go hold them accountable. That's kind of my thing. And then city of Chico, it's funny because people go, well, why do you go to the city of Chico? They don't have anything to do with it. Oh, really? They just did a Facebook ad for the flu shot at the city of Chico. Right. Facebook page. Sorry, you're now accountable. I'm now coming back at you. And I have the mayor of Chico on my group list. So my group list, when I send emails out every day with the latest and greatest research and information for my Butte County group list, besides the supervisors, it's the chief administrative officer. He's the highest. He's like the CEO. You think of him like the CEO of a corporation. So that CAO is the highest paid. He's not elected, but he's the one that's calling the shots. So the CAO, district attorney, the sheriff, the supervisors, my state assemblyman, my state senator, my congressman, and then whoever else is gets to be included on that email, and the city of Chico mayor. You guys all need to work together. It's not rocket science,
describe what we see here. Basically, this is Riverside County Sheriff Chad Bianco. Julie and I met with him via Zoom last June, and we both share our respective whistleblower stories. And he said, look, prior to the administration of the COVID-19 vaccines, I had deputies having strokes and heart attacks in their 50s. Since the administration of the COVID-19 vaccines, my deputies are having strokes and heart attacks in their 20s. So we met him, like I said, last June, but last month, Julie and I were able to participate in a gubernatorial forum because Sheriff Bianco is one of several Republicans who are running for governor. So this picture was taken last month where we met him for the first time.
Yeah, he was, when we had that Zoom call, he was, we had a half hour with him. And so when we first got on, you're like, how much time do we have? He's like, oh, I'll give you as much time as you need. How about an hour? We're like, oh, the guy was that invested. Now he goes, I didn't take the vaccine. He said he didn't push the vaccine. So like my Sheriff Honey in Butte County, it just boggles my mind. I filed a criminal complaint for my own injury with all my evidence with my sheriff to give to the DA. And then I had a meeting with him one-on-one. Now he did a TV ad for the vaccine as an influencer. So he did a 30-second spot saying, oh, I took the vaccine and, I'm not going to tell you what to do, but, in my opinion, I took it. And then he brought it into the jail and he had the prisoners, vaccinated. So each sheriff kind of has their own story. And, Sheriff Chad Bianco, he's like, well, what do you think I can do? I'm like, my God, well, I have to tell you, you're the law of the land. I mean, you've got a gun and a badge. So let me start there. But
right.
How about as a coroner, you start to investigate the deaths? So how about if I send you all the VAERS reports? Because see, we can't get county level out of VAERS. We can get just all of California, but I got date of death, date of birth, age, et cetera, all this information. How about I send you an Excel file? And me and Albert can send him an Excel file. You then go, look at it according to all the deaths in your county. And if you find a match, then you go investigate that death as a crime and go find the person, et cetera. And he's like, you know what he literally told us, guys? He said that under the emergency orders and since COVID, the public health, the medical officer of the county has more power than the sheriff. And now Sheriff Honey told me that kind of the same thing. He goes, Julie, the governor's coming after us sheriffs. He's trying to get us, to be fired. And this, I go, I don't care. People are dying. Kids are dying. So, right. We're trying to work with these sheriffs and kind of remind them that they have a badge, they have a gun,
Exactly. And they have the duty to, uphold the Constitution and their constituents. I feel the same way about the sheriffs when it comes to the protocol deaths, right? Like they have an absolute obligation to do something. And I know that they're targeted in terms of, they get these visits, but not to, they get kind of coerced to not touch shots or protocols, but I'm like you, Julie. I'm like, you got a badge and a gun. If that badge means nothing to you, if your oath as a constitutional, that's the sheriff who is, then quit, hand it off to somebody who has a badge, a gun, and a spine, right? Maybe maybe that's what, you add the spine in there, and maybe it'll make all the difference.
Yeah.
Well, as Julie says, we've got one sheriff that we met with last month. We're going to be meeting with him next Monday. And that could be the sheriff who takes the courageous lead. And I'm hoping that others will follow. There are other sympathetic sheriffs. And I'm hoping this one sheriff is that sheriff that will make that step.
Yeah,
So
he committed. He said that he's got a Zoom call twice a month with all of the Northern California sheriffs, and then they do every other month, I think, as a group, like through the Sacramento and this, that, and the other. So we're just arming him with a lot of information. And for me, again, the what I try to focus in on with the sheriff now, because like we got the pharmacies, right? Like the sheriff's like, what do you want me to do with the pharmacy? Like walk in and like start arresting the pharmacist. I'm like, well, okay, let's start there. Sure, why not? I mean, I don't know, lock up the vials. How about this? How about you go serve an order and say, these bioweapons are being stored in this facility and I want them out of there now. So you hand over all of the vials that you've got in this pharmacy. You go to all your pharmacies. There's not that many of them in said county, and lock them up. You got to think of it like it's a bioweapon, like it's a bomb. It's a ticking bomb.
Yeah.
You just let ticking bombs be stored anywhere in the county,
Exactly. And it would be nice if, the OBGYNs would quit pushing the shots on the pregnant mothers. Because as we know through our friend, nurse whistleblower Michelle Spencer, the babies are being born at a skyrocketing rate, and it has not slowed down since the rollout of the COVID-19 vaccine.
Well,
I read through that case this past weekend, and I knew that Fresno is not the only county in the United States or California where there's been a peak of fetal demise. And I think, as I remember, Dr. James Thorpe is quoted as saying that there's been fetal demise everywhere.
Everywhere.
Yeah, it's across the whole nation right now. And
birth defects. I mean,
can you, Gail, when you say birth defects, can you be specific? Can you be graphic about that?
So babies are being born with deformities in their hearts.
Yeah, deformities in their hearts, club feet. I mean, like physical and outward and internal is what I have read and seen. I know several mothers who got the shots thinking that they were protecting their families. That's the sad part is, a lot of these people that got these shots felt like they were doing the right thing. Mm-hmm. And I know people who their babies were stillborn, or they miscarried and they suffer the menstrual, irregularities, or they can't get pregnant. Or I know one, their daughter was born with clubfoot, another with a deformity to the face, and blood, like they normalize blood clots in babies and children, which is absolutely insane. I do think too, if they take away the immunity and they take away the incentives, and doctors become responsible for the outcome of giving that shot, right? Because they know, right? They know there's no way you could have. I mean, what was it? The bird flu shot or whatever they pulled way back during Ford, I think it was. And there were 53 deaths. And you're talking like almost how many deaths have there been that you have to kind of guess because they're hiding the information, but it's tens of thousands or more, maybe
millions.
Yeah. The FDA recently, as you know, came out and they admitted 10, but it is far more than that. But at least that's a step in the right direction.
Well, they said 10 children, but we know it's more.
Oh, we
they,
know it's a lot more.
they only looked at 100 cases, and so I there's absolutely no reason that this bioweapon should still be on the market. So,
Exactly.
Yeah, I was I sent, I think, this information to Michelle too. So at Enloe, all of a sudden in 2022, they were getting what I call a cold caught by this company called Born Sleeping, that's going around all these hospitals in California because they have these cold caught things to keep stillborn babies viable so family members can come in and say goodbye. I'm like, when I saw that and they were highlighting it at Enloe, like, look, what a wonderful donation we just got. I go, why do we have to have these in the first place?
right.
Exactly. Why do we have to have them? And in that leaked email, right, that community hospitals here in California sent out, they described a skyrocketing increase in babies being born dead, and for the nurses to brush up on how to properly place a baby in a bucket. And it hasn't slowed down. That email was sent out in the year 2022, and the babies being born dead had not slowed down, and the OBGYNs are still pushing the shot.
And I know
Heidi,
different.
38,983 deaths in bears. That's as of January 2nd. And add 2 zeros.
Okay.
So you add 2 zeros
Yeah,
to that. So
add
that's
2
minimum, so
You're right.
4 million.
Right, because they're underreporting, gaslighting people. It's anything but the shot, right? It's anything but the shot, and So I'm gonna ask, like, just some in closing. I do want to know what people can do to help you and Ron get the message out, but I also want to tell people, if you have a vaccine injury or have somebody was killed by the shot, we like to call it what it is, killed by the COVID shot. I want you to go to betrayalprojectusa.org and submit your story, sit down for an interview, because we are not just telling the protocol stories. We want the shot stories and other medical institutional betrayal as well, because if we don't have large numbers of people standing up and saying, this happened to me. You saw it work with the Maha moms. It took a long time. Imagine how hard it was for them to find their child dead in a crib and still go out there and tell your story and be gaslit and told that you're the ones that hurt your baby, SIDS, blah, blah, blah. As soon as I heard SADS, like you, Julie, I was like, that's some BS that somebody made that up to say anything but the shot. But tell people how they can help you get the message out, join you, find you, and go ahead. I'll go to Julie first and then Ron.
Yeah, I mean, for me, the biggest thing is to please share my information. So you can see on the screen at Julie4Butte5. I ran for supervisor, so I was running for Butte District 5. But so Julie4Butte5 on Twitter X, follow me, share my stuff. I will post on there today, since you just reminded me. I haven't done it in a while. So when my mom died and I knew it was the vaccine, I immediately got on a video with Albert, and we filed my mom's VAERS report, and we did it almost as a tutorial. So it's a way that people can watch the video and see the process and what information you're going to have, because you only have 20 minutes to do it if you're going to do it online. And so we step people through the process and how to prepare and what information to have. So anybody out there, if you have loved ones that were vaccinated by this shot particularly, get their vaccine card. Keep it, hold it. You might need it. And that's what saved me with my mom. I had her vaccine card, so I had proof. But have that ready. And then, you can go to and then, there's a place on Albert's, the VAERSaware.com site, where you can put in an intake form and we can help find information. I had a friend here in Chico. So her dad had 2 COVID shots, and then it was the flu shot that killed him. So she's like, oh, I'm not going to let him die in vain. So again, she filed a VAERS report. Now she called, so she was okay. And actually, I will tell you, calling into VAERS, and just go to their website and there's a phone number, they're actually being very accommodating. They're being very nice. They're being very, I think that they've got good people in there now that are helping with some of this information. So call VAERS, just call them and go, here's the information. Here's my, when they died, here's the information, and put that in. And and then again, if you get it within a year, file a CICP claim. If it's a COVID vaccine, I filed my mom's CICP claim within a year. If they die within a year of their last countermeasure, so I did it within the year, and then sent the information up to HRSA. That's the people that are collecting all the information about the deaths. It's not VAERS, it's the HRSA who is collecting all the COVID claim information. So do that too. Yeah. But follow me on Twitter X. And we have a new community space called End All Tyranny. We rolled it out last night. End All Tyranny. You'll see it pinned at the top of my Twitter page. Join it.
Tell them why.
Truly.
Yeah.
End All Tyranny. We literally have a space every single night for 3 hours to talk about tyranny, to talk and have researchers and victims and doctors and lawyers, and we play video clips. And there's so much information now. The 3 hours flies by.
If you guys could get a message to President Trump, what would you say to him?
Oh, I already gave my message to James Roguski because he asked me that same thing. I said, President Trump, Operation Warp Speed was a failure. You need to get us there to the White House, get the injured, get the bereaved, get the protocol victims, and get in front of you at the White House. Give us a chance like you gave to Zuckerberg and you gave to Bill Gates, and have these dinners and have all these things. No, we get to sit down with you and share our stories. And then I bet you come to the same conclusion, sir, with all due respect, that what this product did, killed a bunch of people, injured a bunch of people, and you need to demand it. Get on the horn right now and go tell the entire planet that you're coming, you're coming guns a-blazing, so to speak, that we're stopping this thing now. And let's get it out of our military, out of our pregnant women, out of our kids, out of this universe, right? And then let's start suing somebody, on behalf of the United States. Get mad.
Yeah.
Well, I would basically tell him that Robert F. Kennedy Jr.'s predecessor said, we know these vaccines are killing people of color, Blacks, Latinos, Indigenous people at about 2 times the rate of white Americans. These COVID-19 vaccines are injuring and killing by the millions. And as Julie said, particularly the vaccine injured, need to sit down with him at I don't think it's a round table, more like a square table configuration. They need to sit down and he needs to listen to their stories. And answering your question about what they can do, Julie and I have to go to 7 counties left: Inyo, Los Angeles, San Bernardino, Orange, Riverside, San Diego, and Imperial. It would be great if somebody or group of people would like to host us at a small, at a restaurant or in their homes or whatever. And I could sell my Muzzle Truth books to help pay the way. That would be great. They can just send an email to ronald@muzzletruth.com or go to muzzletruth.com to buy my book in paperback, in ebook, and audiobook. And I did read the audiobook. And share it with someone who may believe that these COVID-19 vaccines are the best things since sliced bread. They need to hear or read about my whistleblower story. And what's so beautiful about it, this is what happened. This is what I observed. And this is how their California Department of Public Health reacted to receiving information that was contrary to these vaccines are safe and effective narrative. They lied. Yeah. CDPH lied. And people are injured and are dying because of it.
Yeah, we definitely need to stop the shots and get accountability for the carnage that's already happened. I mean, so many have already taken it either because they were afraid, or they were coerced, or they were threatened. There was a huge campaign to, the carrot and the stick kind of thing. So I appreciate you both being on, and look forward to doing more with y'all. And I just want to make a plug as well. People will go to your Twitter accounts and they're like, "Whoa, I shared the first, I shared this speech and this speech." Keep sharing it. It is very important for each of them to go wild. It's not just about the content that is delivered. It is about letting the public know that the message has been delivered to that board even if it's the same message per board, it is important that every single time you speak at a board of supervisors or a council, that particular video goes viral, so that everybody knows those individuals that serve on that specific board have been delivered the information over and over again. So very important. Go ahead, Ron.
One last thing. Javier Becerra, he said on April 14th, 2022, we know these vaccines are killing people, et cetera, et cetera. I just checked. It's still on the White House's official YouTube channel.
Oh,
That's
all right.
part of the public record. It's still there. They could have taken it down. It's still there. He could have retracted his statement. It's still there.
Yeah, exactly.
It's still there.
We need to make that go viral too.
Yeah.
Thanks, Ron.
And by the way, Javier Becerra is running for California governor.
Wow. That's
what I said to AG Bondi. Hello, why aren't you arresting? I mean, Fauci's got immunity, Giovanni's got immunity, but can we arrest Javier Becerra? That man is a criminal. He rolled out the protocols to the hospitals. He rolled out all of this, nonsense. He's responsible for all of it. The lost learning, the kids, the social distancing, the isolation of your seniors. He did all of it. Go get the man.
Yeah. Everything criminal, absolutely criminal. Well,
when I make a mistake on the job, I feel bad.
Right. They don't.
Oh my God, I did it. I used to go into my boss's office. I want you to hear it from me. I messed up.
And it didn't even cost people their lives.
Yeah. That's right.
Yeah.
So sad. It's laughable.
Yeah. Well, thank you both. And we love working with you guys, and we look forward to doing a lot more. I'll be joining that community End All Tyranny today.
Yay.
Thank you.
Yeah.
All right. God bless.
God bless.